Today we have Manikandan sir, team manager HR department from Omega Healthcare. So thank you sir for conducting the drive with the Race Institute for a medical coder and the AR position.
Thank you, sir.
Sir, so just give us something detail about the Omega Healthcare.
So, to talk about Omega Healthcare, we have, Omega Healthcare is a, leading healthcare industry, healthcare, company in the world. And if you look at, we have started in the year of 2004 with the headcount of 4. And currently, we have an employment headcount of close to 31,000 employees working across locations actually. So, whereas we have branches in Chennai, Bangalore, Hyderabad, Coimbatore, and recently we have started our branch at Navi Mumbai as well. Okay, so we are expanding like the way wherever we can get an opportunity to engage and to provide an opportunity to the newbies so that we can grow ourselves and we can give an opportunity to the youngsters as well.
Okay.
Whereas if you look at Mumbai and all, you have market of paramedical candidates, whereas coming in, which is very important for the medical coding industry.
Which are the various career opportunities in Omega Healthcare?
So when it comes to Omega Healthcare, we are not only dealing with medical coding, so where we have an opportunity with the AR caller, medical billing, payment postings, and data entry as well. So in addition, we have few verticals working with medical data analysts. So we have these kind of fields only with Omega Healthcare. So you not only look at medical coding, so we have all the RCM cycles being with Omega Healthcare.
Sir, give us just short idea about the medical coding. What is medical coding?
Medical coding is nothing but it is a conversion of patient medical records into a universally accepted alphanumeric codes. Whereas these codes being used mainly for a claim purpose, for the insurance companies. Whereas in India we can see that the patient will be doing doing that payment and taking the treatment. But it is a different case, like whereas the patient from US healthcare, they are taking a treatment and the hospital is reimbursing that payment from the insurance companies. Okay. So we are doing that coding for the insurance companies. Not only with the this coding is used for claim purpose, it has some background purposes as well, for a say for an example, in case of any to track the particular disease which is spreading across very faster. So it's giving an idea about which is having larger impact in the global, and it is used for certain kind of things. Okay. We have few other factors as well.
Sir, what is the career growth in medical coding as per the position wise and salary wise, average salary?
If you look at medical coding's future, looking at that current scenario, in that currently we are in a society where we can see that people are getting a disease immediately. They are walking and suddenly they are getting cardiac arrest or whatever they are getting they find it immediately, and we can't see them anywhere. So looking at the society and this current social environment, we can see that a lot of diseases are coming in. So and the chronic diseases which is very threatening in the world, and the people are aging. So still the time it is we are coming into the position where we are not into a position of finding a new disease or not facing any health related threats. This industry will be grow and
grow very fast.
Yes, really very faster.
So and they selected initially as a junior medical coder.
Yes.
Then after that, what is the other
so position? The position where you start with junior medical coder or trainee. So whereas you will be gradually increasing your growth into this in this industry, like next level you will be moving as a coder, and then you will be moving as a senior coder, and then you will be moving as a process coach or quality control analyst. Which department you wanted to choose, okay. You can choose it. Then team leader, senior team leader, assistant manager, and then senior manager, DGM. This industry, the growth will go, like this. To make sure that you're growing, in this industry, you have to upgrade yourself. Whereas this medical coding industry is getting upgraded. This is the only industry where you cannot stop learning.
Okay. So is there any other certification?
Yes, like there is lot of certifications to make sure that you are growing very faster, and make sure and to ensure that you are aligned to this process. The medical coding industry is requirement. We have a certain kind of certifications like CPC, CIC, COC, BCHSC. So these kind of CRC certifications, right. We have these kind of certifications here.
But sir, CPC certification is mandatory to join as a medical coder?
Definitely definitely I can say that CPC is on one of the certain kind of thing that we have to look into that aspect. But whereas certain kind of clients may not be keenly looking on the CPC certification.
Okay.
But it is mandatory. Once they started their job, after 1 or 2 years it is mandatory. But when if you look at Omega is open to everyone, and we are giving opportunity even for the non-certified coders.
Okay.
And the certification is mandatory even if you are starting as a fresher, but it is very minimal part. Out of 100, you can see that only 10 or 20%.
So what is your expectation from the candidate at the time of selection?
At the time of selection, when it comes to a non-certified coder, basically I'll be looking at the candidate's knowledge on human anatomy and physiology as well as medical terminology. So the reason why, if you look at a patient report, it is completely written on the medical terminologies. Whereas the people has to understand, if somebody don't have a knowledge on these things, they cannot do it.
Okay.
They cannot understand the report properly, and they cannot identify what has been written on the report.
Yeah.
They just go and read it out in English, but they may not be aware what is that exactly. That is the main reason we need the candidate should be
Anatomy, physiology.
good enough in anatomy and physiology and medical terminologies. That is most important. And this is for non-certified coders. But say for an Excel, if I am a certified coder,
Yeah.
I'll be looking at your, apart from this medical terminology and anatomy and physiology, I'll be looking at on your ICD guideline, ICD guidelines, procedures, modifiers, and MDM table related, all these things. Since you are a certified coder, you have written an exam by paying, close to 70,000 rupees, and you cleared it. Whereas you should, have all the knowledge on, whatever required for a coder.
Yeah.
The certificate, CPC itself says that, it's certified professional coder. So I need to know, I need, all this knowledge, whatever required for a professional coder, I need all the criteria to have.
Very good. Sir, from last 2 years, you recruited the candidate from the Race Institute also. So what is the quality of the student, and what is your expectation from the students or from the training, as you train the student and you prepare the student for the interview? So what is your expectation from us?
So basically, if you look at, we are doing this drive for the past 2 years with Race, and we can see that, the quality of candidate is good, and, we have had close to 35 plus people last year.
Yeah.
And we can see that quality of the candidate is really good. So they are, easily understanding the requirement and what the, their immediate supervisor is giving, and what is their need, what they are expecting from them, and what they have to do, and what they have to act according to the situation. Everything, they are doing it perfectly, and we can see that quality is always in a high standard from these candidates. And even after that, we did one more drive, and then we are just conducting. So really the quality is really good. Whereas our expectation in another part is that these candidates are good at human anatomy and medical terminology, but still if they can improve themselves, excel themselves in a better way, they know everything. Okay, and they are giving it away, but still they have a bit of nervous and other things and all. They are hesitating, I can say, bit of, since it is a first time interview, all these candidates are coming in, so all these things will be there. But yes, this can be trained to them on if you provide additional soft skill training to them on these kind of things, they can improve it definitely.
Sir, we observed that in medical coding field, initially growth is very slow, but after 1 year or 2 years with CPC certification, the growth is very good. So what is your observation regarding that?
Definitely, when you're starting, anywhere if you go, you need a time to learn the thing, to excel yourself. So you're doing a medical, you become a medical coder, and you cannot become a millionaire in overnight. Yeah. You need to learn each and everything. When medical coding, it's like ocean. It's like an ocean. You have a number of things to learn, and we don't have even only a single specialty. We have a lot of specialty like ENM, ED Profi, facility, IPDRG, home health, anesthesia, radiology. We have all these specialties. Whereas we will not ask a particular employee to work in all the specialties, since it is very difficult and it is very tough for everyone to work in all the specialty. We will be aligning only in a particular specialties to all the employees, and we'll ask them to work on that. And if you look at, you need to have a time, minimum 6 months to 1 year of time to learn and to understand the things completely. Then you can look for further opportunities, or you can look for a growth further. So this will give you, I'm completely learned about the things, whatever that I need to have, to become a professional,
Professional medical.
coder, and I may not need anybody's support, when certain kind of target is being assigned to me. I can do it myself itself. I will not look for somebody else there. So for this, you need a time of 1 year period. By the time the particular person would have learned, a lot of things, and within the timeline, if they complete their certification, so that is going to be added advantage. It is like one lecturer, one lecturer in a college want to become a professor. He wanted to add a PhD, and he wanted to learn, each and every things, and he wanted to understand. He wanted to give his, lot of inputs to that, so that he can become a professor. So similar to that, this coding industry is working.
One of the last questions, sir. After the COVID, the first question of the student is there work from home available? So is it available for fresher or is it available to experience also? What is the scenario nowadays?
It is a scenario like 50-50. I can say that, but
But for fresher, is it available?
freshers,
I think
mostly we will not be having a work from home opportunity. If there is a work from home opportunity for being a fresher, I can say that you cannot learn anything.
Yeah.
Since when you're working in an office, you have your colleague, your friends, your colleagues, your supervisors, somebody seniors working around you. Your team leaders will be there,
Definitely.
process coach will be there, quality control analyst will be there. In case if you're stucking anywhere, somebody will come into the picture and they will be helping you. If you're stucking somewhere, while you're working at home, nobody is going to come and help you.
Yeah.
You cannot reach out to anyone, by the time whenever you're looking for it.
Yeah.
If you're working from office, the person, who is most senior or a quality control or team leader will be sitting next to you.
Yeah.
You can, just, go to his desk, I have this kind of doubts, can you just clarify? Yeah. And you can get a lot of insights by looking at, their, how they are doing it, and what correction they are making it to make sure that they are doing it perfectly, and what, the steps they are taking it to improve their, skills. So you can upskill by looking at, others when you are working from office. And the most important thing that I can say is that fresher working from home is not advisable, at least for minimum 6 months to 1 year of time period.
Okay.
So that you can learn something.
Yeah.
Okay. So if you look at post-pandemic, we are looking for work from home. Before that, there is no work from home option.
Yeah.
There is no virtual interview. There is only walk-in interview. There is only working from office. So nobody has come up with any questions, and nobody has come up with a concern. But post-pandemic, the time has changed. So people are expecting, but that cannot be a stoppage for everyone from learning things. So that is the things, better to choose a work from office.
Okay.
At least minimum 1 or 1.5 years. That's what we can advise for each and
So thank you, sir. Thank you for such a awareness interview from Manikandan, sir. So as per Manikandan, sir, we understand some points. The first, that is for the medical coding, anatomy, physiology knowledge is very important.
Definitely, sir.
Your base is required very clear. If you are a CPC certified candidate, then you learn CPC in depth, not just qualify the exam, right?
Exactly.
Then third, that is the first year is for the learning, not for the earning.
Not for the
So you focus on the learning, not on the earning. Then the growth is good when you complete the certification. And the fourth, that is upgradation is very important in medical coding for the grade, that you have to qualify the CPC, then CIC, then CRC, then again the upgradation. I think AI in medical certification in medical coding is now also available.
AI is getting implemented in medical coding, but if you look at the ICD 11 implementation is coming in, but the human presence is most important when it comes to
These questions are also asked by the students. Is AI due to the AI there might be the in medical coding the human replaced by the AI? Is there any chances?
In medical coding industry, if you look at there is a possibility of AI coming in, and AI already it has started, automated coders and everything is. But still, if you look at AI cannot do anything.
Yeah.
It is very important that some humans should be there to make sure that some kind of critical codings are being done. AI cannot go and read all the files and do it all these things. Sometimes you need to apply practically yourself to understand. You cannot go just by the machine.
Okay.
It's like, so say for an example, it's like I'm mucking up things and going and writing up an examination. That cannot be thing. But if you ask me to go and do it something practically, I may not be aware. I know something what I mucked up, and I can do only that one. Something is out of box. Somewhere we'll be in a position of we will be stuck somewhere. So this human
AI
importance
not
will be there.
replace the human being.
AI cannot replace completely this one. It can be a part of, but it cannot replace
It
inner
increase
human.
the accuracy in the coding.
Yes, to make accuracy, to make sure that accuracy is perfect.
Perfect.
Human is very very important here.
Okay.
We cannot depend on AI when it
Oh.
comes to medical coding.
So thank you. This is also very important point because a lot of students ask, sir, due to the AI, how is the jobs in the IT healthcare industry? Is it safe or not? So such type of question asked by the students, and thank you. You give the very good
Thank you, sir.
explanation about this all the question. So
Yeah.
thank you, sir. Thank
Thank
you,
you, sir.
and
Thank you for this
so we will
opportunity.
meet soon, sir.
Thank you so
you.
much.
Thank you.